Hi, I'm Julie Schirmer, and today I'm going to be talking to you about identifying and managing burnout. Why now? As I record this, our hospital system has been taxed, and all of our communities have been taxed with the COVID virus. ICU beds are at an all-time high, and the good, compassionate care that we provide is being challenged. Christine Maslach, who is an expert researcher on burnout, identifies three components to burnout. One is emotional exhaustion, feeling completely depleted, frustrated, snappy, coming out as anger. Second is depersonalization, the feeling of being disconnected from yourself and from others, a feeling of not caring. Third is a low sense of personal accomplishment. So futility, hopelessness, as if what you're doing doesn't count. Sometimes it's easier to identify this in others, and when you do, don't wait. We all learned, or many of us learned in team steps, to use the CUS or CUS mnemonic, each word upping the ante in terms of urgency. The first is C is for concerned. I care about you and I'm concerned about what I'm seeing. Second is uncomfortable. I oftentimes start with concerned, caring, and then I'm uncomfortable with what I just saw happen in room 206 with Mrs. Jones. And then the third is safety. When you see safety being an issue, you need to hold the line, take a time out, pull the person aside and say, when what I just saw, I think is unsafe. And here's what I saw, and here's why. Hopefully it doesn't get to that point in that you have to get to that, or someone says that to you. But when it's pointed out to you, or you're listening to your own self-talk and you're seeing this, what I suggest you do is utilize what Russ Harris talks about. Russ is the author of The Happiness Trap, which is listed in the resource list at the end of this presentation. He says to name burnout, tame it, regain vitality, and reclaim your life. So naming it. Naming, you can't tame what you can't name. So listen to your self-talk and the messages you or others give you. Consider taking the Maslach Inventory. There's a free link in the resource list. Consider talking to a really trusted other. What do they think is going on, and what seems like the best plan for dealing with it? Taming it, recruit a personal support team. It could be your primary care provider for a further assessment. Is depression or anxiety or PTSD playing a part in this and needing treatment? Pursue counseling, either through someone that you know, someone that you're referred to, or our employee assistance program, which provides 6 free counseling sessions. Consider a job coach or going to one of the wonderful groups that are listed on the WOW page of our intranet site. Prioritize time to develop a plan to tame your burnout demons. And then regain vitality instead of emotional exhaustion by developing a lifestyle fitness plan, reconnecting to your values, or utilizing what Eisenhower called the urgent, important principles. What's urgent, non-urgent, what's important, not important. And oftentimes in times of crises, urgent things kind of take precedence, which that can undermine your very important thing to take care of yourself and develop a plan of resiliency. Consider aligning your values, getting back in touch with your values and aligning your actions with those values. Why did you get involved in healthcare in the first place? Was it because you wanted to heal? Because you wanted to provide compassionate care that you saw not being provided to friends or family? Next is regain compassion instead of depersonalization. First, avoid multitasking. Consider developing a mindful practice. There are many resources in WOW and in the Virgin Pulse app. As a matter of fact, Virgin Pulse, you can earn money by developing a mindful practice. And then learn and apply the breathe out principles that family practitioner Jennifer Edgegoose writes about and researched in dealing with frustrating situations or difficult encounters. There's a link to this interview in the resource list. Finally, replace futility and hopelessness with a high sense of accomplishment and hopefulness. Consider developing a gratitude practice, and with that practice, include a daily review of what you learned, of a positive patient encounter, a new insight. Remember, whatever you do only grows larger. Sonia Lyubomirsky and Jason Marsh provide the hows and the whys you would do this. And then finally, reclaim meaning, joy, and vitality in your life. So please practice these principles, take a deeper dive into the resources listed in the slides after this presentation, and thank you.